Well, welcome to the Doctor's Edition. I'm Dr. Rita McGuire, the Chief Medical Officer here at Wakana, one of the co-founders. And tonight is the night that healthcare professionals and even lay folks can come on and really learn about the difference between CBD and medical marijuana. I am an obstetrician gynecologist of over 30 years. I attended Wayne State School of Medicine. I graduated and completed my residency at Cook County Hospital here in Chicago. I am CEO of RJM Wellness and Rip3 Fitness. I'm a global women's health and wellness speaker, also a certified physician for the medical marijuana program, as well as a member for Doctors for Cannabis Regulation. I, again, am one of the 4 co-founders and chief medical officer here at Wakana. I want you to meet our medical advisory board. Many of these members you may recognize. They are not only advocating for the cannabis plant and our CBD products, but they are also utilizing them and offering their expertise as it relates to our education program here at Wakana. So let's talk about really how cannabis became so mainstream. And I laugh because Dr. Sanjay Gupta in 2014 had to make a public apology. You know, he had to come back and really give his accounts of why he said no to cannabis and now why he is saying yes to cannabis. See, he said that he didn't dig deep enough. He didn't dig into the research. He didn't talk to enough scientists, and he didn't talk to enough patients who have gotten such dramatical changes in their health from the cannabis plant. So when we look at the cannabis plant, it has 2 species. One on the right, as you can see, is the marijuana species. That's the one that gets us high, gives us the euphoria, gives us the paranoia, and even the munchies. And then there's hemp. Hemp is the non-psychoactive part of the plant. It does not give you the high. It doesn't give you the euphoria or the paranoia. And the reason being is that hemp has very small amounts of delta-9 THC. See, it's the delta-9 THC that gives us the high. And marijuana has high levels of delta-9 THC. Hence, it gives us the high. Now, both species, marijuana and hemp, do contain CBD, but it's the hemp portion that gives us all the health benefits, plus it gives us industrial benefits as in producing clothes. Many of you may have seen hemp underwear and hemp shoes. In fact, they are making homes out of hempcrete. You know, the very first Bible was constructed on paper made from hemp. The very first automobile, the Model T Ford, was constructed from hemp, as well as the gasoline was constructed from hemp as well. So we can see the many, many uses, but for you, if you're new to cannabis, let me remove that negative stigma, is that this plant offers a species, which is hemp, that has low amounts of THC, which gives us the health without the high. So when you go into a dispensary that is a recreational dispensary, or maybe you meet someone that has a medical marijuana card, they're utilizing products that are sourced from marijuana. Our products here at Wakana, tonight's conversation is about CBD that's sourced from the hemp plant. So we understand that even the way that it characteristically looks is different. See, marijuana is typically a taller plant, or a shorter plant, excuse me, and is a bush-like appearance, whereas hemp is very tall and lean and grows about 20 feet or more. In 2018 is when hemp was legal. See, before that, hemp was categorized with cannabis as a whole. But in 2018, which is an agricultural bill, they passed the legalization for hemp to be utilized, consumed, cultivated, and grown. And so now what we're seeing, finally, is a lot of large institutions, a lot of universities are now able to do research on humans as it relates to the benefits of the hemp plant. So all of our products are legal in all 50 states for consumption, for cultivation, as well as for sale. So when it was removed from the Schedule I drug classification, it allowed not only research to be done on humans, but it allowed more access to those who are looking for a way to address their health, but not be high. Because right now, if you're a patient and you want a medical marijuana card, you will go into a dispensary and get a product that will give you a euphoria, paranoia. Whereas hemp, now that it's legal, it can be utilized, and you can utilize something to have a health without the high. So let's look at some of the only FDA-approved CBD medication, and it's called Epidolex. See, Epidolex is used for those children who have seizure disorders. They may have Lennox-Gastaut, they may have Dravet syndrome, they may have tuberous sclerosis. They have an issue that this pharmaceutical company took advantage of the CBD and hemp, and they made a synthetic version of it called Epidolex. Epidolex is about $3,200 a month, and it's for children who have seizure disorders. There's some other medications out there that are THC derived that are legal in the United States, that are used for pain, they're used for nausea and vomiting, for those who are undergoing cancer treatment. And one medication is called Syndros, another one is Marinol, and then there is Sesamet. These are all approved by the FDA, but they are THC-derived products. Sativex, which is a 1-to-1 ratio, 1 to CBD, 1 to THC, is not approved in the USA, but this is a medication that's used commonly in the UK for those who have severe pain or nausea and vomiting from cancer treatment, or even those who are HIV positive and cannot maintain a healthy appetite. So just know that now we have an alternative, which is CBD, that won't give you the high, that won't cost $3,200, and is a safe and effective product, because our patients are looking for an options. Our patients are really quite frustrated with the fact that they're on so many medications, but they're still not having the quality lifestyle and health that they're looking to have. So they're looking for CBD. These are some of the top reasons that Americans are utilizing CBD: for relaxation, for stress and anxiety. You can imagine how much stress and anxiety we have with this 2 year of a global pandemic. To improve sleep, to relieve muscle pain and chronic pain, to relieve joint pain. So many reasons folks are looking for CBD, even different age groups. We're seeing the baby boomers. Each and every year, the percentage of baby boomers utilizing CBD for different reasons has now increased to 49%, as well as those Gen Zs and millennials. Each year, their usage of CBD, as they understand how they can use a product without giving them a high, how they can be productive at work. They can be productive if they're at home with childcare without getting the high. So let's talk about CBD. CBD is an abbreviation for cannabidiol. And again, we're talking about CBD that's sourced from the hemp species tonight, but it has many, many medicinal benefits. CBD is an antibacterial. It inhibits cancer cell growth. It's neuroprotective. It promotes bone growth. It relieves pain and anxiety. It's being used in oncology for nausea and vomiting. It's being used in cardiology. Cardiologists are understanding that CBD can help to relax the blood vessels. It can help reduce blood sugar levels. It can help reduce cholesterol levels, which will reduce heart disease overall. But there's other players that the plant makes, like CBC and CBG and delta-8 THC. All of these cannabinoids or compounds that the plant produces is a synergy when it's combined with CBD. We call that the whole plant or a full spectrum. Our body also produces cannabinoids, just like the plant. So on the right side, you'll see the word phytocannabinoids. That means that the plant produces these compounds. But on the left, you see the word endocannabinoids. And endo meaning endogenous, from within. Our body produces cannabinoids very analogous to the plant. So we have anandamide and 2-AG. Those are the top two endogenous cannabinoids that our body produces. They produce our body to feel blissful and happy. And 2-AG is important to reducing inflammation and pain. So just like CBD and THC and CBC and CBG, just like all of those compounds the plant makes, our body produces similar production as well. But the problem is, unfortunately, when we are under stress, when we're not sleeping well, when we're not eating a proper diet, when we're consuming all this pollution, when we're drinking water that's polluted, right? Our body is deficient in endogenous cannabinoids. So that's why we all should take CBD. Every last one of us on this line should utilize CBD. And the reason being is that the science behind how CBD and the other cannabinoids work in the body is present in everybody that's on the line. It's called the human endocannabinoid system. This is the science behind how CBD and the other cannabinoids work in our body. See, this system is deemed the most vital regulatory system in our body. It is made up of receptors, CB1 and CB2, as you see on the slide, that are found in major organs and glands, like our heart and our lungs and our liver and our skin and our teeth and our stomach and our intestines, even in our reproductive organs, like our uterus and testicles. See, these receptors, when you consume CBD, they bind to these receptors and they send signals to area in the body that needs balance or needs homeostasis. So this is the uniqueness on a bio or a physiological system that none of us was taught in school. I wasn't taught this in medical school, but this system puts us in balance when we're out of balance. The system puts us in a state of less stress, of less depression when we're anxious and depressed. This system helps us sleep when those neurotransmitters like serotonin and dopamine are not being able to be released so that we can sleep, so we can be in a better mood. So when we utilize CBD, it's really important that you know for your patients, if you're a healthcare professional on the line, that CBD possibly could interact with medications that you may or may not, that you may be on, not may not be on, but may be on. And they can interact in an antagonistic way or inhibit the effect of the medication you may be on, or they may cause a potentiation, not an antagonist, but an agonist interaction, and make that medication you're on work even more, right? And the good example is that of Coumadin or warfarin, right? If you're on a blood thinner, there's a possible interaction that when you use CBD, it can make your blood even thinner. It can make your INR even more prolonged. So with that being said, it's important that if you're on warfarin or Coumadin, which is a blood thinner, or if you're on theophylline, or if you're on some of the seizure medication, speak with your physician. It's not that you can't take CBD, but you may need to monitor those levels a little bit more. Now, CBD, like many medications, are metabolized in the liver through a pathway called CYP450. Now, this pathway is the reason why there could be a potential interaction with medication. Drug testing, CBD possibly could show up on a urine drug screen depending on the type of CBD that you're utilizing. If you're utilizing a full spectrum product, that is a product that has the legal limit of THC, it possibly could show up in the bloodstream, in the urine. So what we recommend for those who have urine drug screens is that we recommend that you utilize a broad spectrum or a isolate so that it does not show up on a urine drug screen. When you're using CBD as a topical, like many massage therapists are now utilizing CBD in their massage therapy sessions, topical products will not pass the blood-brain barrier. They are safe, they won't pass in your urine drug screen. But again, if you're using a full spectrum product, if you're using a product that has the legal limit of THC, though it's so small, there is a risk of it showing up on a urine drug screen. In fact, they used some patients and they looked at research and they noted that patients who were taking large doses, we're talking 1,000, 2,000 milligrams of CBD. That's a lot of CBD, guys. There was a 11 to 23% chance of that CBD, which is the THC part, showing up in a urine drug test. And that brings me to the fact that a lot of these urine drug tests that are over the counter or point of care tests are not very sensitive or specific, right? These urine drug tests you get from Walgreens or CVS, they don't know a cannabinoid from another cannabinoid. When they see CBD, they just light up positive. There are some urine tests that will be very sensitive and specific. And if your employer is testing you, please recommend that your employer use LabCorp. They're a huge lab all over the world. LabCorp has a very sensitive and specific urine drug screen that will pick up CBD, and that's what you want to do. So there's a lot of CBD products out there. Your patients may come to you and say, "Doc, I got this CBD product at the gas station. Is it okay?" No. The answer is no, it's not okay. Not all CBD is made equally. CBD should be sourced from a reliable source, a source that's growing, cultivating the hemp organically. That's important because hemp is a bioaccumulator. So whatever is in the soil will be in the product. Mold, mildew, heavy metals, pesticides, you name it, will be in that product. It's very important that there is third-party testing, that the product before it hits the consumer needs to be tested again to ensure that the potency is legal, meaning it's 0.3% or less of THC, ensuring that there's no harmful chemicals, pesticides, or residual solvents, to ensure that what is in the bottle and what is on the label is really in the bottle. And that's what we do here at Wakana. We have established our third-party testing through one of the top ISO labs in the country, Green Scientific, that does all of our certificate of analysis to ensure that you're getting a very safe and a very potent product at the same time, but a product that's sourced from hemp and not marijuana. Another thing that is of importance is how the CBD is extracted. How is it removed from the biomass? Our process is through a supercritical CO2 extraction process. There's all sorts of ways of extracting the oil out of the plant. There's butane, there's propane, there's water, there's alcohol. The supercritical CO2 method is one of the cleanest. It is more expensive, but it's one of the cleanest ways of extracting, and it's one of the safest ways to extract for the environment as well. So there's a lot of ways to consume CBD. Your patient may want to use a tincture or a gummy or a topical or a water soluble. There's some patients that would rather just swallow a capsule. Whatever way that you're utilizing CBD, let your patient know that it's important to layer the products. It's important to utilize different methods of consumption, because as one product is working, the other one is wearing off, and your patient has a steady state of CBD in the bloodstream as they're getting relief. So there's a lot of science out there, like I said, since the 2018 Farm Bill, since CBD has been legalized, lots and lots of science. You can get that science through PubMed. They're doing a lot of studies on cannabinoids in the management of difficult to treat pain, for anxiety disorder, as well as cancer treatment, therapeutic potentials for really mainstreaming CBD for nausea and vomiting, for those who have side effects during chemotherapy. CBD utilized in those who have GI disorders like ulcerative colitis, Crohn's disease, reflux, irritable bowel syndrome. I would like to now go through some of our products. Our products are, again, third-party validated. They are all available with a certificate of analysis. Our products are sourced from Oregon and Colorado, and our products are sourced from farms that are growing hemp organically. This is an example of what our third-party certificate of analysis looks like. It will utilize a picture of the product along with the potency, the percentage of THC, and all of the testing for mold, mildew, heavy metals, pesticides, mycotoxins, and terpenes as well. Really easy to read certificates of analysis, pass, fail. All of our results are passed so that you can utilize those certificates very easily. So as I go through some of these products here at Wakana, the FDA requires that we read this statement, that the products, that these statements made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by FDA-approved research. These products are not intended to diagnose, treat, or cure, or prevent any disease. All information presented here is not meant as a substitute for your healthcare professional. So please talk to your healthcare professional about potential interactions or other possible complications before using any of the products. The Federal Food, Drug, and Cosmetic Act requires this notice. Well, we have our tinctures. Tinctures are oils that you put underneath the tongue. And last week we had Dr. Joseph Rosado, who gave us a nice little nugget that if you really want to increase the bioavailability of a tincture, that you hold it in your mouth for a minute before you swallow, but you do a swish swish. You swish it around in the mouth, so it's really being able to be absorbed maximally in the mucosa membranes of the mouth. Under the tongue, there are glands. So swish, swish the tincture before you swallow for 60 seconds. Optimal bioavailability. So our tinctures come in our full spectrum that gives you the legal limit of THC, in our power product, which is 0.3% or less. And then we have our broad spectrum products, our pure products, which contain less than 0.0% of THC. We even have a water-soluble product, a product you can put in your liquids, like your juice, your water, your smoothies. We have a more therapeutic product, our hemp MD, which is our most potent CBD tincture, 900 milligrams of CBD in that 15 ml bottle. We even have a tincture that addresses hair thinning, hair shedding, excessive shedding, alopecia, hair loss. That's our empowered hair. Just know that if you have random drug screens, you are utilizing our pure product, which is our broad spectrum product. Start low and go slow. Whenever you're utilizing CBD for the first time, when you're instructing your patients to utilize CBD, 3 drops twice a day is a great way to start. So our topicals offer local relief to those areas of inflammation and pain. Our number one seller in our topicals is our Extreme Power Pain Cream. That is a product that you can utilize on joints, on muscles, in the area of the temple, if you're having a migraine, in the back of the neck, if you're having some trigger points. We also have a liquid formula, which is our Dr. Rita's Rub. All of our products have a proprietary formula, a formulation, where we enhance the CBD with essential oils to reduce even more of the inflammatory that occurs in the body when we're talking about symptoms that are due to arthritis or gout or sciatica. When we look at our edibles, they are absolutely the favorite when it comes to our products giving relief for different areas, like the need for better restorative sleep or reduction in inflammation, or even boosting our libido. We have products for libido. So our power gummies are our full spectrum gummies. We also offer our broad spectrum gummies, our pure gummies. We also offer Delta 8. Delta 8 is a close cousin of Delta 9 for those who need more creativity or more reduction in discomfort in their joints and muscle. Delta 8 is a little bit more potent than CBD. We also have our flat belly brew, our coffee, and our flat belly gummies. That's part of our weight management. CBD is known to help to reduce bad fat, that white fat, to brown fat, that good fat. These products help to reduce the appetite, helps to reduce cravings for sugar and carbs. So our flat belly products are amazing. We also have essential oils. We have what we call our first defense. Not only is it enhanced with CBD, but other essential oils that really help to reduce bacterial and viral loads. It's a nasal spray. So you simply use it in the nasal area or nostrils. And this is where viruses and bacteria and lots of germs enter our body. Our smokables are coming. We are very close, but right now we have a Delta 8 smokable. It's a pre-roll where you're able to get within 1 to 5 minutes of pulling and puffing on the pre-roll. It's like a cigarette or it's like a joint. You're able to get relief very quickly for those acute issues, those acute onset of headache or migraine or joint pain. You're able to get relief very quickly. And then we have our culinary products. Our culinary products will enhance your recipe as you're getting relief that you're looking for. So our garlic fire, our flavor king, our chili lime, all of these spices are infused. Our vegan butter, CBD, our culinary plus, you can bake and cook with this particular product. So this is a way to spice up your recipes in the kitchen. Our SOS system, our Save Our Strands, global pandemic going on, also with hair loss, also with hair thinning, with shedding, both in men and women and children are losing their hair. They're losing their hair at alarming rates because of the COVID infection they may have had, along with other medical conditions. But the number one reason we're seeing children losing their hair and thinning and shedding, it's because of the trauma of traction, the trauma of two types of braids and weaves, and all of these things are doing to our hair. So we offer a solution. We offer a shampoo, a moisturizing conditioner, a leave-in detangler, a styling cream, the empowered hair I talked about, and even men who have thinning of their beards. All of these products are infused with CBD because we know that skin is the largest organ, and our skin has receptors that are looking for CBD to keep the hair follicle in balance. And then when the global pandemic hit, we did a pivot, and our sister company is called Royal Defense. Royal Defense is products that are providing you a safe environment for your home and office. Our hand sanitizer, our surface cleaner, our produce wash are amazing products as well. Our sexual health line is another line that offers you better health sexually by addressing vaginal dryness, vaginal pain during intercourse. Even our King of the Jungle gummies offer you products in a gummy form, in an edible form, that helps boost stamina and helps to improve your libido. We look at all of the recommended dosing. Start low and start slow. If it's a gummy, start with half a gummy. If it's a tincture, start with 3 drops twice a day. If it's a topical, start with a little bit at a time, and then you can increase if needed over time. So these are some of the products that, yes, you can offer as an option for those patients who are looking to reduce their medication for diabetes, or even come off their medications for diabetes. Utilizing CBD, utilizing the fact that CBD helps to reduce blood sugar levels by reducing the inflammation in the pancreas and improving the beta cells to be less resistant to insulin is absolutely an option. Even for lowering cholesterol, for those patients who are looking for a holistic natural option for lowering their cholesterol, starting low, starting slow with a tincture is the way to go. So there's so many great choices. You can't go wrong. We want you to be open to join us, to purchase some products, to recommend our products to your patients that are looking to utilize CBD. Don't send them to the gas station, because those products, we have no idea where they're coming from. So I want to thank you for tuning in. If you have any questions, if you have any concerns, if you have any critiques, you can email me at ritamd@wakana.com. That's ritamd@wakana.com. I will invite you to our business overview. Our business overview is at 8 p.m. in about 20 minutes. I will be going over with some of my business partners, again, our leadership, our mission, our vision here at Wakana, more in depth of our product line, and then the opportunity. See, there's an opportunity as well to have an additional stream of income that can support your practice, that can support your overhead, that can support and bring wealth to your family as well. So I'm going to stop sharing my screen. I'm going to take some questions. If there's any questions out there, you can put it right there in the chat. If there's questions, or you can put it in the Q&A area. And there's no Q&A area. There's just a chat. You can put it right there in the chat. If not, if there are no further questions, please join me at 8 o'clock to the business overview. If you're a guest on the line, if you're a healthcare professional, please connect with the person who invited you so they can get your products ordered. They can get your questions answered. And there is a question, recommendations for bad sinus issues. So my recommendation for bad sinus issues would be absolutely, without a doubt, our first defense. Our first defense is our nasal. Our first defense is our nasal spray here that has the CBD and essential oils. It will help to open up those sinuses. It does contain essential oils with the CBD. CBD is an antibacterial. Many times a sinus infection can occur as well as inflammation. So for bad sinuses, I would recommend our first defense. You're going to put one spray in each nostril every day. I would also recommend utilizing the power or the pure tincture so that the CBD is really in your bloodstream working to reduce those symptoms of sinus. If you have random drug screens, I would utilize the pure, 3 drops in the morning, 3 drops in the evening. If not, the power, 3 drops in the evening, 3 drops in the morning. Along with that, I would recommend the black seed as well. So I would recommend 3 products if you have bad sinus infection or bad sinuses. Black seed is an essential oil that addresses everything. It will also aid in reducing inflammation and clearing up the passageways in the nasal area and the sinuses. So the 3 products I would recommend for bad sinus is our first defense here is a nasal spray, our black seed, which you can put 3 drops under the tongue in the morning and 3 drops under the tongue in the evening, along with the tincture, which is our Hempranium 500. But if there's drug screening going on, our pure 300, 3 drops in the morning, 3 drops in the evening. Let's see if there's any other questions. Can you mix any of the tinctures with tea? Yes, you can utilize our Power Water Soluble with your tea. The Power Water Soluble is a great product here that can be mixed with any liquid. So it can be tea, it can be coffee, or you can just purchase our Flat Belly coffee, which has CBD in it already. You can put this in smoothies. You can put it in water. So anything that's liquid, you want to use the Power Water Soluble. Wonderful. Great, great questions this evening. So again, if you're a guest on the line, please connect with the person that invited you. If not, we'll see you at 8 o'clock. We'll see you in about 15 minutes on the business overview. You don't want to miss it. Again, we will see you next Tuesday, 7 p.m. Be well, be safe, and see you all very, very soon.